Hi everyone, this is Group 4's presentation on childhood obesity. We have an upcoming public service announcement to create and present to our class, and in this video we will be presenting to you our outline. The topic introduction will be our first discussion point. We will include the prevalence of childhood obesity. 17% of children ages 2 to 19 in America are obese as of 2011 to 2012. 20.5% of children ages 12 to 19 were obese as well. These statistics call us to bring our attention to the disease and look for ways we can decrease the rate of obesity. According to the State of Obesity Organization website, childhood obesity has more than tripled since 1980. Throughout the PSA, we will be discussing the disease and what it is, introduce you to our target audience, and present treatment options given to us by a medical professional. The second part of the outline is the definition of childhood obesity. Obesity is defined as a condition when the person affected has excessive body fat and has a body mass index or BMI greater than 30. There are many risk factors that come along with being obese. These negative health risks may include type 2 diabetes, high blood pressure and cholesterol, heart disease, sleep apnea, and various respiratory problems. There are also many psychological issues that come along with obesity, especially in children. These include depression, low self-esteem, risk of eating disorders, and even behavior or learning problems. Richard Strauss completed a study on a large number of children that suffered from obesity. He performed the study to research the mental stresses that come along with this disease. Next, I'll be talking about our main target audience. The main target audience we hope to reach out to are the parents and guardians of children, specifically parents and guardians of obese children. We chose this group of people as our target audience because parents and guardians are the people who spend the most time with the children. Grace Ratu writes that parental strictness can affect obesity rates. If parents tend to be more stern with their children in basic life routines, they have a lower chance of becoming obese. We are hoping to inform them of this disease, health risks that come along with it, and teach them ways to prevent obesity, and if their child is affected by obesity, ways that they can help their child to lose weight and to have a better quality of life.
Obesity plagues so many children in America, and we believe that it is important to inform as many people as possible about the issue and give advice as to how it can be prevented and treated. One of our group members performed an interview with pediatrician Tara Shammy, MD, and asked for her professional advice on the topic of childhood obesity. Dr. Shammy was asked to answer 3 questions concerning childhood obesity. She was first asked how she thought childhood obesity is affecting our society. Dr. Shammy stated that children are becoming less active and eating a lot of processed foods, and that they may be following by the example from other role models in their life. We also asked her what health issues her patients were presenting because of their obesity, and they are type 2 diabetes, depression, anxiety, high blood pressure, and cholesterol, and a few more that were mentioned earlier in this presentation. Finally, Dr. Shammy was asked how she was addressing a child's obesity to their parents. Obesity or any illness can be a touchy subject when a doctor has to tell a parent that something may be wrong with their child. Every parent wants to believe that they are doing a great job raising their child, and they very well might be, but obesity is a big problem that must be dealt with carefully. Our pediatrician responded that when she has to talk to parents about their child being overweight or obese, she makes sure that they can see it on paper, that this is a real problem. The child's height and weight are recorded and plotted on a chart with other children their age and where they should be according to the data. Typically, if a child is overweight, it will be easy to see in the chart that they are given. Dr. Shammy offers advice to the parents on what they can do to help their child and may even suggest that they see a specialist in that area. The full interview can be listened to on our childhood obesity website. We also performed 3 separate polls to get outside information on what the public thought about childhood obesity. The first poll taken asked the responder if they personally knew anyone who was suffering from childhood obesity. We interviewed 10 people for each poll. 60% of the responders claimed to know a child who suffers from obesity. The second poll wanted to know what were some suggested food options that would be healthier than the typical processed and fatty foods that children like. Most of the answers we received included fruits and vegetables, yogurt, whole grains, and organic or natural products. The final poll offered the responder to list any ways that they thought would help a child lose weight in order to have a healthier lifestyle. The 10 responders that we collected all involved suggestions of exercising and having a healthier diet. Our final point in the PSA will be the closing statements. We will be discussing the hardships that obese children face on a daily basis, such as bullying or not participating in school activities or extracurriculars because they are too physically unable. The CDC states that children should have at least 60 minutes of physical activity every day. If the children are able to complete this, it may help them lose weight and become more confident about their physical abilities. Confidence will be very important for children who suffer from obesity because they may experience bullying or other hardships and consequences to their disease, and so any amount of self-esteem that they can build is good for them. We hope to reach our target audience with a strong public service announcement that is backed by strong evidence and facts as to what the disease entails.